Hey, Dr. Crifase here, and in this video, I'm going to be covering how to get the most accurate thyroid test. As with any diagnostic information, we always want to make sure that by doing the test or procedure, we will get the most accurate results, not just any results. For example, you can get an MRI or an X-ray of your body, but if it is not the correct view, or if the X-ray or the MRI needs a dye injected into the body, this will obviously change the results that are provided and expected of that test or procedure. Now, the same goes for any laboratory tests. So timing, body rhythms, hormonal changes, medications, and more. These all need to be taken into account so that you get the most accurate test results. Again, not just any results. Because treatment and therapy plans are often geared towards the results, this is really important. So the first major point of how to get the most accurate thyroid test is you want to stick to your normal routine the day before your test. You really don't want to get your test done on a day that you feel extra stressed or even ill. We know that stress affects many body tissues in many different ways, and excess cortisol can actually block the conversion of T4 to T3, which will affect your TSH levels as well. Number 2 is you want to test your thyroid before you take that day's thyroid medication. For example, if you take your test, your lab test, after you take your medication, which could be, say, Synthroid, Cytomel, or even other bioidentical hormones like Armour thyroid, your free T3 levels may be mistakenly or artificially high at that point. And this goes for other pills and medications as well. For example, even supplements like biotin or vitamin B7 can interact with your thyroid levels and should be avoided for at least 2 days prior to testing. So make sure, for example, if your test is at, say, 9 in the morning, that you want to take your medication after you take your test, after you get your blood drawn. Number 3, which is kind of an extension of the last point, is you want to test your thyroid in the morning, preferably between 7 and 9 a.m. And this is because if you test your thyroid later in the day, your TSH can actually appear artificially lower than it really is, which will give you an inaccurate result. Since your thyroid or hormones are produced in accordance with your circadian rhythms, which are known as your sleep and wake cycles or sleep and wake rhythms, this is really important to test when they are highest in the body. And so that is according to thyroid. Number 4 is you want to follow your fasting recommendations for your test. If your thyroid test needs to be done while fasting, which it often is, you want to schedule it for as close to 12 hours of fasting as possible. Now, dehydration affects your testing results just as much, so make sure to drink at least 8 glasses of water or enough water prior to and on the day of your test. Drinking water is perfectly fine to do, and it's highly recommended. Now, the flip side to this is that you want to test your thyroid before eating any food or drinking anything besides water. So if you test after eating a meal, your TSH can actually look artificially low. So before you want to make sure before your test that you're not consuming any food, coffee, or other liquid besides water. And if you eat or drink anything besides water prior to testing, this can affect your results and can cause your free T and your free T4 to look lower than they actually are as well. Now, number 5 is you want to test your thyroid at least 3 months after your last thyroid dose adjustment or your dose change. Now, you can test it sooner than this, but if you do, you want to make sure you take into account the fact that some of your levels will not be as stable or level as they once were. So most often, we want to be testing your TSH and other markers about every 6 weeks, and this is to get a bigger picture approach and to measure any incremental changes on those labs. Number 6 is you want to make sure that you test your thyroid before you are pregnant. So if you know that you are trying to conceive, you want to make sure that you get the most accurate results prior to that. During pregnancy, thyroid levels usually fluctuate more than normal. And so having base results and base testing to compare to is very important. In addition, it's often recommended to get testing done every single trimester that you are pregnant to confirm any previous stable levels, as well as to confirm if you need any medication or dose changes. Now, immediately before, during, and after pregnancy, there are many different surges in hormones, as I'm sure you know if you're watching this. So don't be surprised if you need more medication or different changes in the dosages while you are going through this process. Number 7 is you want to make sure you're eating and drinking what is normal to you prior to your test. For example, you don't want to get your testing done after a big change in your diet, such as say after a holiday, a vacation, or even a party, or even starting a new diet regimen, such as going keto, paleo, or any other diet out there. And also, you don't want to start a new exercise routine or do any type of strenuous workout prior to your test as well. Large changes like this can actually affect your results because this can throw off your body rhythms, and this can literally thereby affect the potential results and give you inaccurate testing. Number 8 is if you are a female with a regular menstrual cycle, you want to do your testing between either days 1 and 10 or days 23 and 28 of your menstrual cycle. Now, this is really important because outside of these days, that is between the days of 10 and 22, there are often increases and decreases of certain hormones in the body. And this can actually cause changes in your free thyroid hormone and TSH markers, among others, and thereby skew any possible accurate results. And the last point of how to get the most accurate thyroid test is number 9, and that is to avoid alcohol consumption prior to your testing date. Now, as we've discussed, certain medications, certain supplements, even excess stress, and more can all affect your test results and your thyroid results, and alcohol places an especially heavy burden on the liver, which can affect binding proteins and much more, and this has certain effects on markers for your thyroid. So as you can see, there are a lot of things that must be taken into consideration and account before getting testing done to make sure that you are getting the most accurate results. The worst thing is to have to go back multiple times to the laboratory facility to get your blood drawn, all because certain pre-test measures and precautions were not taken into consideration. So thanks for watching. I'm Dr. Crifase, and I'll see you next time.